Well, hello and welcome to the Hooked on Health podcast. Today, I am honored to be joined by Dr. Rekha Nair of Rhythm Medical, a direct primary care physician-owned practice. So, welcome, Dr. Nair.
Thank you, Sean. Thank you for giving me this opportunity to be a guest on your Hooked on Health podcast.
Awesome.
Health is my favorite topic.
Yeah. So tell us a little bit about yourself and how you became, what drove you into medicine in the first place.
Yes. So I am a primary care physician, double board certified in internal medicine and lifestyle medicine. My journey started as a child back in India, when the family physician used to visit home to take care of my grandparents. And I was fascinated by his gadgets. I used to follow him around, and I really got interested, and I used to always tell my parents, I want to be a doctor when I grow up. And I kept that passion on and got into medicine. And here I was working in the traditional insurance-based primary care practice for 15 years till I made the switch to direct primary care, which is membership-based, November of 2024, and that's where Rhythm Medical was born.
Wonderful.
Yeah.
And what inspired you to make that shift from the traditional model to your new model, which is membership-based?
Yes. So in the traditional insurance-based primary care, I had a panel of about 2,500 patients, and I was a part-time physician. So my last patient of the day used to be 2 p.m. I had to see 13 patients in that time, which gave me about, on an average, 20 minutes with each patient. But the national average actually is 12 minutes per patient visit. And you can see in that limited number of time, how many concerns can you address? And people usually have multiple concerns. So that was very frustrating to me. 3 years back, my husband introduced me to direct primary care. And I was really curious about that model. I started attending those conferences, and I was thrilled that there is a model where I can really try to help patients without any time constraints. So that's when I decided to make the switch. And in November of 2024, I started Rhythm Medical, where here, as opposed to the 2,500 patients, I can have a much smaller panel of about 400 patients, and I can dedicate all my time to take care of their health.
Yeah, it's incredible. What are some of the most common lifestyle-related issues that you're seeing in sort of like the middle-aged population? Let's call it like 40 to 60.
Yeah, great question. Most of the cases that we see are lifestyle-related diseases. Particularly, we call them as metabolic disorders, which encompasses pre-diabetes, diabetes, hyperinsulinemia, high blood pressure, heart disease, obesity, you name it. We not only see this in the in the middle-aged population, but in young adults as well.
Yeah.
These conditions many a time start in childhood. So, because these are lifestyle-related diseases. So, it depends on what your lifestyle is, and that really takes you moves forward, and you develop either a full-fledged florid diabetes, obesity. Where we really want to work on is to help them change the lifestyle. So that's how I help, because these are lifestyle diseases. You want lifestyle medicine to help reverse these diseases. You cannot really manage them with medications.
Yeah. And I think most people are, at least myself, I don't really want to take a medication. I'd prefer to try something holistic or, non-medication based. And that's sort of how we run concierge is,
Correct.
a lot of our patients are, I wouldn't say addicted to opiate analgesics. Some are, but they rely on Advil every single day to get through musculoskeletal pain issues.
Right.
so, we talk about root cause medicine, and,
Right.
that's what we talk about at concierge is
Right.
stretching, and loosening up, joints and tissues to make sure that you can basically move and feel better
Right.
and not be reliant on pain meds.
That's right.
Talk to me about root cause medicine as opposed to sort of the traditional path
Yeah.
that has been sort of the history of medicine.
Great question. So, in the conventional medicine, you basically are treating the symptom or sign of the disease as opposed to what is causing your disease. And most of these chronic diseases are lifestyle diseases.
Yes.
So, unless and until you change the lifestyle, you're not going to see an effect. I'm going to give you an example. I have this 49-year-old gentleman who came to me at Rhythm Medical. His main issue was frequent urination. He was waking up 6 times at night to go to the bathroom. And so he had a really fragmented sleep that made him feel very tired during the daytime, very stressed out. He had seen his urologist, got all the workup done, and nothing was found, and he was started on the medication to control that urge.
Mm-hmm.
He comes to me and he goes, I'm still not feeling any better. It's continuing. And that was his first visit with me.
Mm-hmm.
I sat with him. It took me about 2 hours to learn his lifestyle.
Mm-hmm.
And what I found was he was drinking 3 or 4 cans of diet soda every day.
Yeah.
So I told him, if you can do one thing, just stop the soda and let's touch base again, come back in 6 weeks and let's see how you're feeling.
Yeah.
And he did that. 6 weeks, he comes and he says, I may wake up once a night, but most nights I don't wake up at all.
Wow.
So his sleep was continuous and he felt very good the next day.
Yeah.
So and I was able to take him off the medication.
Yeah.
There it was. The root cause here was diet soda. That's one small change.
Yeah, that's incredible.
So, yeah, you just need that time. I just needed that time to understand his lifestyle and help him make that change.
Yeah, you're not getting there in 12 minutes.
No, I'm
That's
not.
for sure.
Right. That's right.
Let's talk more about food, right? So, and I think in Diet Coke, there's the aspartame that's sort of been a hot topic in the late 2000s and early 2010s. But let's talk about food is medicine, right? Mm-hmm. So what are some of the nutrition myths that you often debunk for your patients?
Yes, that's another one of my pet peeves. So food is medicine. Like Hippocrates, the Greek philosopher and physician, he has said, let food be thy medicine. Mm-hmm. And Paracelsus, the Swiss physician, he said the dose is the poison. So just like medication, the type of medication you consume, the dosage that you need, and when you have to take the medication, it's very similar with food. Yeah. The type of food you eat, the amount you eat, and when you eat. That, is very much applicable to your health. So food is medicine. Yeah. And one of the biggest myths, I like to debunk in people is the artificially sweetened beverages or the diet beverages are much better than sugar sweetened beverages.
Yeah.
No, it's not. It's, studies have shown that these diet sweetened beverages, they increase your insulin level, and that's how they increase the risk of diabetes, of fatty liver, and inflammation in your body. They interfere with your gut microbiome and lead to all the digestive issues and chronic inflammation and metabolic disorders.
Well, I have to tell my wife that because she loves Coke Zero.
Okay, I can talk to her.
I love Coke Zero too, but it's funny because I think let's talk about habits too. So, mm-hmm. I feel as though oftentimes, and I'll talk about myself personally, I get into a habit of eating healthy for a while, and then when I go to eat McDonald's with, my kids love McDonald's because they're 3 and 6, and every time they go past the Golden Arches, they're like, stop.
Yeah.
Or it's just quick and easy as parents. We're coming back from a long ride or on a road trip or something, and we stop. Oftentimes, when I am eating healthy, I don't even want to eat McDonald's, or like I'll eat a couple nuggets and I just feel gross 2 hours later.
Right.
But if I'm on a stint of like not healthy eating, I'll eat it and it doesn't affect me at all. Talk to me about that experience.
Yes, it's so right. When you have the habit of eating healthy, your brain, it really doesn't want that unhealthy food, So you just have to make small changes. Now, I understand, some people need like to make change in all their like six pillars. There are 6 pillars of lifestyle medicine, and some need to make change in all 6. But I always tell them that, small steps. Some may be able to do it. It's very rare, all 6 at a time. But usually it's just, baby steps, 1 step at a time. And even if when you're eating healthy, I usually tell them, follow the 80-20 rule. 80% of the time, if you have, healthy food, that's great. 20% of the time, if you want to indulge, sure, go for it. But be mindful of the dosage. Be mindful of the portion that you're eating. For example, if you want to enjoy that ice cream, with your kids, go for it. But don't have that huge cone of ice cream, because here, even a small serving of ice cream is huge, 3 huge scoops. So just ask for a kiddie scoop, a really small portion, and enjoy it.
Yeah, no, that's great advice.
Yeah.
The top 5 foods that everybody should avoid, what are those?
Sugar sweetened beverages.
Including artificially?
Yes, sugar or artificially sweetened beverages.
Okay.
Your lunch or deli meat.
Okay. Even if it's from Whole Foods?
Yes.
Okay.
Yes, absolutely. Even if Whole Foods or Wegmans, and when it says, organic, even that.
Okay.
Anything packaged, they load it. They preserve it, right? So they have like a lot of sodium preservatives in it.
Okay.
Your packaged snacks.
Yeah.
Your chips or the Doritos or whatever, the gummies.
Yeah.
Then, many of, so these are the 3 main, I would say. And then of course the refined, the refined carbs, the refined starches, where you'll do the cakes or cookies. Kids love to eat that. Yeah. So any of the refined products.
So that's the top food sort of 4 for you.
Yeah, it encompasses. Yeah.
Now, conversely, what are the top 5 things that everybody should have in their diet?
So, I know there is dieting. I think it's a very modern concept.
Yeah.
If you look at our grandparents' time, there was no dieting.
Yeah.
It was only eat the natural food.
Mm-hmm.
So when you follow that, there won't be anything like, have these top 5 food. But if you ask me specifically, it's the whole food, nutrient dense diet. Have plenty of vegetables, lean meat, beans and legumes.
Yeah.
Those are great sources, because you need everything. There are different diets out there, like you have your keto diet, where you're avoiding carbs completely. Yeah. You don't want to do that. You need carbs. You need good carbs, and good carbs are the whole food, with the whole grain, which is not processed. For example, like hulled barley or quinoa. Yeah. They are, whole grain, or the starchy vegetables like sweet potato. Potato, if you're having with skin, but limited. Yeah. So anything like, you need all 3 sources. So this is what I would say, the natural food.
Yeah. So. Let's talk about Rhythm Medical for a minute, right? Mm-hmm. So you talked about the 6 pillars of lifestyle medicine.
Yes.
How do you feel like that marries with your internal medicine background and sort of that traditional background versus Rhythm Medical? Talk about the 6 pillars and how you guys are different at Rhythm.
Yes. So, in the traditional medicine, we have been taught, treat the disease, right, or the symptom of the disease. And with the time constraints, we are not able to do much for the patient, even though most physicians, we want to do right, and we do spend a lot more time, which leads to physician burnout because you're working all the time, right? At Rhythm Medical, we really try to encompass the 6 pillars of lifestyle medicine, which are your nutrient-dense whole food diet, natural movement, stress management, restorative sleep, positive social connections, and avoidance of harmful substances. So we sit with our patients. So my patients get to sit with me up to 2 hours for the first visit, and up to an hour or even more for follow-up visits. So I really, learn about them, about their lifestyle, their family dynamics, in detail, and help them incorporate, what changes as needed. As I said, it can be small changes, one change at a time, one change a month, or one change in 2 months. Some people may take longer. So that's how I try to help them. And at Rhythm Medical, the other thing is they have direct access to me. When they have an issue, they can text me, and I'm the one answering them. So if there is anything urgent, they know that they can just pick up the phone and call me directly. And if it's not urgent, I will respond to them in a reasonable time frame. So people have even texted me from the grocery store asking me, Dr. Nair, is this food good to eat? Can I buy this? So it's very personalized. So I think that's what differs Rhythm Medical from the traditional insurance-based primary care. In the traditional medicine, you can never text your physician directly.
No.
It has to go through multiple steps before the message reaches your physician.
Yeah, the MyChart, the MyChart relay. Yeah,
Yes.
I think we're all familiar with that.
Yes.
Talk to me more too. So, I think where medicine is headed is a much more specific response, right? So prophylactic blood work to see where nutrient deficiencies, lie. So talk to me a little bit about that and what you're doing, for your patients prophylactically to treat them, when not sick, instead of to prevent, and I love the total body approach, right? Because it really is, those 6 pillars are salubrity in a nutshell, right?
Yes.
Instead of going to the doctor, I have the flu, or I need a Z-Pack or whatever. What sort of testing, what are you running? What sort of panel? Let's use a 45-year-old male or 50-year-old male or female.
Yeah.
What panels are you running for them, and what does your baseline evaluation look like for that?
Yes. So at Rhythm Medical, we usually include the panel that is geared towards assessment of the lifestyle diseases, because as we know, these lifestyle diseases are the main issue, and it's just exploding. So we include the complete lipid panel, which is your cholesterol, apolipoprotein B, which is the protein which carries your LDL. So for example, say the LDL comes back high and the apolipoprotein B is normal, we know that LDL is not the problem. Then we include the comprehensive metabolic panel, which is your blood sugar, your electrolytes, your liver, kidney function, your A1C, which gives you an idea whether you are a pre-diabetic or a diabetic, and we include fasting insulin. Now, a person can have normal blood sugar and normal A1C, but if their fasting insulin is high, we know that person is heading towards pre-diabetes or diabetes and fatty liver. So that's where we start, and then we sit with them and go over their lifestyle in detail, give them recommendations where they can change their lifestyle, and then reassess them in 3 or 4 months with the same panel. And all this is included in our Rhythm Medical membership.
Yeah, that's great. I know one of the hot topics is, and these are popping up everywhere for men, is the game day men's health, where they run, and I feel like everybody's on, what is it, NAD plus or NAD, or I don't know. I'm not sure if you're familiar, but they run testosterone panels and Talk to me a little bit about that.
Yes, we see quite a few, men. They come in and saying, "I'm feeling tired. Can you check my testosterone level?"
Sure.
Again, lifestyle. So when you sit with them and find out that they're probably not getting enough sleep, because lack of sleep, quality and quantity, is one of the big factors in low testosterone in men. There was a study which was done, I don't know exactly when. It was a small study, but they studied 20-year-olds for about 2 or 3 weeks. It was a very small study. They made them sleep for 8 hours and tested their testosterone level, and then they deprived them of sleep. Like they slept for about 5 hours and then checked their testosterone level. There was a drastic drop in the testosterone level.
Interesting.
So yes, sleep plays a huge role. So usually, I'll run, I'll say, yeah, sure, we can check your testosterone level, but let's talk about your lifestyle.
Yeah.
And then if we can work on making any changes in your lifestyle, that may be beneficial for you. So
yeah, that's great.
yeah.
And then another thing that comes up often in conversations, especially when we talk about preventative care, are genetic testing and genetic markers, and that comes up kind of often in conversations about, should I know whether or not I have this marker or that marker? Do you run any of those panels or blood tests?
I don't run the genetic markers, but what I run is lipoprotein A, LP little a, which is genetic, which is your risk of heart disease.
Got it.
So you can follow all the lifestyle pillars, and your cholesterol numbers may be great, but if your lipoprotein A is high, your risk of heart disease is higher than the person who doesn't have that marker. So knowing that, I do help them with a combination of lifestyle medicine and evidence-based medicine.
Yeah.
So do you need medication? I'm not opposed to medication, because medication has a place. Yeah. So there are situations where, I run those marker and say, okay, maybe let's try you on this just to keep your risk lower. So that's one thing. Yes, lipoprotein A is something I do check, and it just needs to be checked once.
Yeah, no, that's great. And I think, that's the beauty of the dual board certification, right? Is that you have sort of the traditional, internal medicine background, but then you've got sort of what I see as the future of medicine, which is the lifestyle medicine piece, which is neat.
Yes.
Let's talk about the busy professional, right? So the person who's too busy to be healthy, right? Yeah. So that person walks into your office and they come to be evaluated. What is your advice to them?
Yes, I understand in this day and age, we are all so busy juggling life, right? But make health your priority, because health is wealth. I would have them start by visiting their primary care physician, know their health risk, and start working on that. Many of these metabolic diseases or lifestyle diseases, as we say, they start way early. And if we don't take care of that in our earlier age, it can only worsen. But information is very important, right? So when you know that you are at risk for developing diabetes or developing fatty liver, and you take charge of that, you can prevent that and lead an improved quality of life in your later stages. So however busy you are, make health your priority and go see your primary care physician. Because one thing, studies have shown that visiting your primary care physician regularly reduces the risk of premature death by 19%. And according to the American Association of Heart Disease and Stroke Statistic Report of 2024, only about 1 in 5 adults in the US, they have optimal cardiovascular health. and which is very important for your longevity and improved quality of life. So yes, make health your priority and go see your primary care physician and take charge of your health.
Yeah, and we talk about, from the physical therapy perspective, there are a lot of studies that show grip strength being tied to longevity, quad strength and glute strength have direct ties to longevity.
Yes.
And you think about it, the legs make sense because that's your tie to walking and pumping, right? And so as soon as you're confined to a wheelchair, your just body it's not moving the lymph, it's not moving the blood flow, and it's just things start to deteriorate.
Right.
And with the grip strength, it's being able to reach and pick things up. It's being able to be active and lifting anything, a gallon of milk, and it's tied to. It's interesting that it's tied to mortality.
Yes, and you bring up that great point, because in our membership we include physical fitness assessment. So we have partnered with InMotion personal training. And so our members get a free assessment and know what they need to work on, which area. So yes, we do include all the grip strength, the upper body, lower body, core, cardio.
That's great. That's what Moonin and Billy over there. Yeah.
Ah, yes.
That's great. Awesome. They got a great thing going. So so talk to me about the future of lifestyle medicine. What does that look like to you?
So that's a great question. It's in US actually spends $3.7 trillion on these lifestyle diseases annually. That's about like 90% of healthcare spending, right? So these lifestyle diseases, you cannot manage them with medications. You need lifestyle medicine to get a handle on these lifestyle diseases. So I think it's going to be the norm. I think the first step would be, educating the doctors and the other allied health professionals on the importance of lifestyle medicine and how we can help patients reverse their lifestyle diseases. It has to be included in the medical school and residency curriculum. Actually, few of the programs have already incorporated this across the nation. So I think we need, all the medical schools and residency programs should incorporate this. And I've been attending this lifestyle medicine conference every year. So every year, the number of doctors and other allied health professionals who are getting certified in lifestyle medicine is increasing.
Great.
So I think this has to be the norm. Otherwise, we are going to see further explosion of these lifestyle diseases.
Yeah. And so talk to me about, and talk to our audience about, those people in their 40s and 50s who are maybe they just had a bad metabolic panel come in, or they had somebody close to them have a heart attack, right? So talk to me about those who are just starting to prioritize their health in their 40s and 50s and what you say to them at Rhythm Medical.
I would say just, start with seeing your primary care physician, knowing your health risk. Know your risk. That's very important. Unless you know something, you're not going to act on it. So start by visiting your primary care physician, getting a health risk assessment done, and taking charge of it, working with your primary care physician as a team to mitigate or minimize those risks. And most of these risks, it doesn't have to scare you. You can reverse it. These are lifestyle diseases, and you can reverse it with lifestyle medicine.
That's awesome. So I always end with one question, and I probably should have given you a little time to prepare on this one, but if you were to have dinner with any 3 people, living or dead, you can think for a minute, who would they be and why?
3 people, living or dead. Oh, that's a tough one.
Yeah.
Right? Okay, let's see. I don't know. I like people, most of them. Because I find, people are different and they are interesting.
Yeah.
So, okay. I love spending time with my friends Okay. We grew up. We are 5 girls who grew up since childhood together. We are still in touch. We are in different continents of the world.
Yeah.
But so we get to meet every few years, and it's a blast.
Nice.
So friends, because that's very important for health, right? That positive social interaction.
Yeah, absolutely.
That is one of the biggest pillars, because it really reduces stress. A lot of oxytocin. You're laughing. So I think my friends, and of course my family. Who else? I don't know. I have to think a little bit more.
We can, maybe if you think of it, I'll ask you one more. So, how do you unwind after a long day?
So when I get home, we have 3 fur babies.
Okay.
A dog. She's 2.5. Absolutely crazy, but a love bug.
What kind?
She's a mixed breed. She's a big girl.
Yeah.
She has pit, lab, German shepherd, and mountain cur in her.
Nice.
Yeah. So just holding her, playing with her, relaxes. It's very relaxing.
Yeah.
And so that's my wind down time. Sometimes I'll just after dinner, my husband and I will watch a movie or a show, and just talk about the day a little bit, and that's kind of helps me wind down. But I do make sure that I hit the bed by 10.
Yeah.
So I don't stay up late, and so I get to start the next day early. I keep the same time every day. Mm-hmm. Try to, of course. There can be one day here or there where I may sleep late, during the weekend.
Sure.
But most days very consistent.
What time do you wake up?
5:30.
Nice. So 10 to 5:30. So that's a good. So what is that? 7.5 hours of sleep?
7.5. Yeah.
Okay.
So as long as you get 7 to 8 hours of restful sleep, that's pretty good. But again, life happens. So
life does happen, especially with a 3 and a 6-year-old.
Yes.
Well, this has been a pleasure, Dr. Nair. Thanks so much for joining the podcast. And so how can our audience reach out to you or find you?
Yes, so they can check out Rhythm Medical. The website is www.rhythmmedicalprimarycare.com, or they can call 425-615-1623, and that's my personal number. So they can call me if they don't get to talk to me directly, leave a message, and I will call them back.
Awesome. So we'll put that in the show notes, and thanks again for coming on the podcast. This has been wonderful.
Thank you. Thank you for giving me this opportunity.